Good morning, everybody. Welcome to this presentation. I'm Vanessa Gorasso and I'm a PhD candidate at Cienzano, that is the National Public Health Institute in Belgium. Today I'm going to introduce you some preliminary results of the burden of cancer in Belgium, and I'm going to cover a lifespan from 2004 to 2017. So this project is part of a bigger study called the Belgian Burden of Disease Study that aims to assess the health status of the Belgian population by estimating the burden of different diseases and using national available data. So the burden of disease is quantified by the disability adjusted life years that is composed by two outcomes. A morbidity outcome called years lived with disability that quantifies the amount of years that a person lives with disability after diagnosis, and a mortality component called years of life lost that quantifies the amount of years that a person loses due to premature death. So today I'm going to focus on cancer since it's a major contributor to the overall burden in Belgium and in a lot of countries, and because so far these estimates were lacking in Belgium. I'm going also to give you some methodological information. So we use data from 2004 to 2017. This data came from the Belgian Cancer Registry. That is a foundation that collects the diagnosis of different cancers throughout the Belgian territory. We used an incidence-based disease model that we adopted from the Global Burden of Disease Study. And we use microsimulation for passing from incidence to prevalence estimates. This means that we use every incident case and time survival time after diagnosis to obtain the number of deaths and the number of survivors at each year. In this slide, you can see some results of the disability adjusted life years for 2017, and we can have a look at the top 10 cancer types in Belgium for the overall population. And we can find lung cancer as the most contributor to the burden of disease in Belgium for both sexes. But we can also observe that for men, this burden is double than the one observed in women. At the second place for the overall population, we find colorectal cancer. That is also the second most contributor to the burden for men. Instead, is at the third place for women. Breast cancer instead is at the third place for the overall population, and it represents a huge burden for women, being right after lung cancer. In this slide you can see incidence and DALY's trends between 2004 and 2017 for the top 5 cancer types in Belgium. We can firstly observe this opposite trend between sexes for the disability adjusted life standardized rate for lung cancer. So we can observe that for female, this trend was increasing, as we can also observe in the incidence standardized rate, whereas for men, this trend was decreasing from 2004 to 2017. We can see also that between the two sexes there is a similar pattern for the DALY standardized rate for pancreas, but for female we can see that the increase was steeper. We can also observe that there was a decrease in ovarian cancer daily standardized rate throughout time. So the main conclusion we can have from this results is that cancer is a major contributor of the burden of disease in Belgium and has a huge impact. And the message that I want to leave you today is that these results can be used to efficiently allocate resources for prevention and treatment, and to have health intervention that are targeted to specific actions. So, for example, the crucial impact that lung cancer has on both sexes can be aimed to be reduced with tobacco control policies. Thank you very much for the attention, and if you have any question, please send me an email to the email you see in this slide, and enjoy the conference. Thank you.